Dr. Scott, what are some of the common misconceptions with women receiving hormone replacement therapy?
Well, generally, as a woman goes through life, her testosterone will peak in her 20s, and she will go through I hate this term, fertility years, where her estrogen will wax and wane, will go up and down and increase growth of cells in her uterus and then recede, and she has a menstrual cycle. Now, as a woman goes through premenopause and menopause, the estrogen will start to sputter and is not going to be released from the ovaries as rapidly as it did through normal, quote-unquote, fertility years. And women will then start experiencing symptoms. Those symptoms are things like hot flashes, night sweats, and mood irregularity. Estrogen has this calming effect that helps to keep us calm, both men and women. And when the estrogen depletes, women start having these symptoms where they will sometimes get in a fight with their spouse or their child and not even remember why or why was it important. And then they will start crying for no reason, just because they have a hard time controlling the emotions. And then when they get into menopause, that becomes even more serious. Now, this isn't true for all women. Some women go through the premenopause and menopause without a problem, but for many women, it is really a quality of life issue. It can be very dramatic. Now, the thing is, as they get to that point, many of these women are going to turn to their closest physician, which most of the time is going to be a gynecologist, and look for help. And frequently, a gynecologist will put them on an estrogen supplement to help balance out their estrogen level and give them a little more comfort through this quality of life or through these issues. The problem is that also, just like men, women's testosterone levels will continue to decrease year by year. The testosterone in women, like men, peaks in the 20s, and as it decreases, women start seeing symptoms like decreased muscle mass, increased fat tissue in the abdomen, decreased libido, anxiety, depression, decreased cognitive function. They can't think as clearly. All of this will slowly decrease as they get older, just like it does in men. But when women are given a supplement for the estrogen, that supplement fools the body into thinking it's producing more hormones and actually causes them to suppress the testosterone or bioavailable testosterone, which will make the testosterone symptoms even worse. So you feel better because you're not having the hot flashes and the night sweats, but you actually can gain more weight, have a lower libido, you have less muscle mass, your anxiety and depression can worsen. All of this can worsen because, unfortunately, the physicians who are treating you don't understand the complexity and how testosterone and estradiol or estrogen are correlated together and how it needs to be treated appropriately. You need to balance both of the hormones or all of your hormones, not just replenish one by pill.
So, Dr. Scott, based on some of the symptoms you've just explained to us, what kind of treatment do you recommend for women who have some of these symptoms?
Well, my preference is pellets, and I can explain that in that the pellets are placed in the hip. They absorb as blood flow goes past them, so you get a nice steady state for months. You get a very stable amount of hormone. Now, the other ways that you can treat ladies with hormones are by pill, but you can't give testosterone by pill. You can only give estrogen. And there have been studies that have shown that when a lady takes an estrogen pill, it increases the sex hormone binding globulin by as much as 171%. That binding globulin binds up testosterone and takes away your bioavailable testosterone, worsening those testosterone symptoms. You can also give estrogen by cream, which you have to do on a daily basis, and there are variations in absorption. You can give testosterone by cream as well, or you can give both of them by injection, which is kind of a pain in the you-know-what. But the pellets are very simple, very easy way to give hormones and a very stable, steady state of hormones.